Hey guys, it's Preston. Hope everyone's doing well. If you don't know me or don't know my story, just a little quick background. I was a physical therapist practicing for about 10 years before I made a decision to switch realms and move more in towards the medical device sales arena. I've been doing this for a little while now, and what this channel and these videos are really dedicated towards is just giving people some insight that may be in roles like I was, or maybe just aren't happy with clinical medicine at this point in their career, and they'd like to look for a change, and they've heard a lot about medical device sales or a little bit about it, but they really haven't heard from a clinician that's actually made the jump. So that's what the purpose of all of this is for, and I try to really go into detail on topics that were really beneficial to me when I went through the process, or that I wish would have been available to me, because there are usually questions that came up quite a bit, but I really didn't have a resource to go to because I didn't know any clinicians that had personally made the jump. So on that note, today's topic is actually in regards to a question that I've gotten quite a bit of feedback on, which is, how are you normally perceived in medical sales since you do have a clinical background? And then further, how do you make sure that the people you're working with, like the physicians, the hospital staff, office staff, how do you make sure that they know you're a clinician? How do you weave that into conversation? And I think those are two awesome questions, because it's things that I use on a day-to-day basis, and I approach things a certain way because of my background as a physical therapist. So first and foremost, what I would say is just to the blanket question of, does it matter that you were a PT now that you're in medical device? Do you get any feedback on that? And I would say absolutely. I would say, if I had to put a percentage on it, I'd say 90% of the physicians or the providers that I talk with, they're very interested when I say that I, practice as a PT for about 10 years. And I think they're interested because, again, it doesn't happen very often. They aren't seeing people like us, like clinicians in these roles a very, very often of time. But I think in addition to that it kind of takes them back a little bit, because they realize that at some point, in my career, I really was just kind of part of the team, right? And so I'm not just the quote unquote salesman. And I think it's garnered a lot of interest with people that I've worked with. I just had a case recently where I was actually observing an upper endoscopy, so an EGD, with a GI doc, and she asked, how long I'd been in my role and all these different things. And so I weaved into the conversation. I said, yeah, you probably wouldn't believe it, but I actually recently left a career as a practicing physical therapist where I treated patients for about 10 years. And she got totally silent, and she says, wow. She's like, tell me more about that. So, sometimes what it really does is it starts leading, that story kind of leads into conversation, and we can connect more on a clinician level. And then once we've done that, now I can kind of veer back in towards the target of, why I'm there, or what I'm really supposed to be talking with them about at that moment, which is usually going to be a procedure, patient management of some type, or of course a product that I'm over. So I definitely have found interest amongst other providers in knowing that that's my background. And I think a lot of them are really intrigued. And I think that would be the same if, you're coming from a nursing background. Shoot, you're a PA, you're an NP, you are a PT, RT, SLP, OT, I'm missing a bunch, but I think any sort of medical realm, I think it really does pique a little interest, because again, they just don't see it that often. And I think what it really does is it kind of gives them a little reassurance as to your motives. Right? They view you in a little different light, because they say, hey, wow, this was this person that they treated patients in a similar way to what I did, for 10 years. So I think that does hold a lot of weight. In addition to that, what I would say is I have noticed that I have been able to garner a little more time than some other reps that I've seen out in the field with physicians. And what I mean by that is once I get to know them, they're definitely not very quick to run me off. And maybe some of that is just in my approach too, because I'm not a bloodthirsty salesman. So I don't go into it constantly selling within every interaction that I'm in, selling a product anyways. I'm usually trying to sell ideas, but really just making it conversational. And so I don't know if that's really just my clinical background or how I approach it, but it's like anything, it's probably a combo of the two. But I've definitely seen that some physicians will give me a little more time than they give other people. And I think that is in part, contributes to that. In terms of how I usually weave in my background into conversation, I will always, when I meet a physician, assuming it's a true meeting where I'm actually going to be able to talk with them for a few minutes and it's not just a handshake in a hallway. I will always weave in my clinical background. And that's just because, again, I found that gains me just immediate buy-in. And it's not to say that they're going to love what I'm presenting to them. It's not to say that they're going to eventually buy my product or anything like that, but it just gains credibility so quick. And I think that was really cool for me to see, because as much as I thought that would be the case when I came into this realm, I mean, I'll be honest with you, how am I supposed to know, right? Just like you wouldn't know either. So you hope that your background, is, viewed highly by others, especially, your previous peers or colleagues in the medical field, but you don't know until you're in it. But it has been, and I think that is really cool. And so I try to weave it into every story, because once I do that, now I'm not just Preston the salesman, right? I'm really Preston the consultant who, man, he used to be a PT, right? Or I should say a practicing PT, because I am still licensed, of course. But I think it just kind of sets me apart a little way that maybe I wouldn't be able to do just by being quote unquote good at my job, right? If you don't have a background in something, you don't have a background in something. But I think being able to speak to things clinically like that, it just holds a lot of weight, and it really gives you a leg up. So, if you're out there wondering, you're a clinician like I am and I was, and you are looking a little more intently into the medical device sales arena, and you're wondering, is my background really going to help? Absolutely it will. And it's going to help with just perception. It's going to help with impact, because you're going to have a different level of empathy and understanding and just that emotional IQ that's related with clinical work. But it's also going to help just in your interactions, right? Because at the end of the day, you are still a clinician. You're just in a different role, and you're not directly treating patients. But that background is going to help. And I think, finally, the last point I would make on that is that my last question that I really had going into this in regards to my PT background was, here I am, I've been a PT for 10 years, but now the realm I'm going into is actually GI. So I work in the gastrointestinal division of my company. And so I wondered, wow, how is this gonna be, right? Am I gonna have any credibility, because it's not knees, it's not shoulders, it's not hips, it's not anything orthopedic, it's not anything neurologic where, things like we are trained in as PTs. So I was a little worried about that. How is a GI doc gonna look at me? Do they ever refer to PT? I've never seen anyone directly for strictly a GI issue. But I will say to them, I think I'm just a practitioner. I'm just a part of the medical team. That's what my background is. So I was really happy about that. So don't also be worried about, do you have to go into a branch of sales of in the area that or that you're most familiar with? Absolutely not. Everything that I sell and I'm a part of on a day-to-day basis, I had no idea about before I took this job. None. So I knew some of the anatomy, which was definitely helpful in my training, but I knew nothing other than that. And, I don't think it has made one bit of difference. More than anything, it just made me have to prepare a little more. But in terms of my background and how I was viewed, it was viewed one and the same. So I hope this was helpful. I hope more than anything, you all, you don't second guess your background. You don't wonder, will it help me? It will help you. Even if it's just personally, it's going to help you. But I can tell you from firsthand, from being out there, it really perks kind of the ears and the eyes of the providers you'll work with, because it's just not a common thing that they hear. And I think it just instills a little bit more trust and a little bit more collegiality, right? A little more confidence as to what you're bringing to the table, and you start moving away from looking like a typical sales rep, and you move more into the arena of being more of a consultant and a peer. So hope that was helpful, guys. Shoot me any comments or questions you have. I'd love to hear your thoughts on this, because again, I know it was something I really questioned as I was making this transition, and I'm sure it's something you're all thinking about too. So I'd love to hear more. Talk to you guys soon. Take care.